out. But the problem is not just confined to the UK. So let's speak to Deirdre Ryan, who's the president of Pain Alliance Europe. Deirdre, welcome here to the programme. An absolutely fascinating report there from Dominic and that survey. Do you think this is something that broadly has been going under the radar in terms of public perception?
Both in perception, but also in terms of access, funding and research. So across the board, underestimated and also invisible.
And those accounts we just heard, are those the sorts of accounts you hear on a daily basis?
Absolutely. I'm a pain patient first myself before president, and that is the lived experience of pain. That, first of all, it can be really difficult to be believed, especially as a woman, never mind a woman of a minority. It's even more difficult. But really being believed and then the path to a diagnosis can take a really long time. That's after building up the courage to seek help, considering there's a lot of stigma around some pain treatments and also about the pain itself. So it's so important that patients speak up, but they are the kind of stories that we hear and the huge impact that it has on people's daily lives.
Yes, exactly the sorts of accounts we were listening to. I thought a telling statistic in this survey was that a quarter of those affected are on opioids with all the dangers of dependency and no real evidence that it's an effective treatment. Why is that the avenue that is so often chosen?
Well, I'll leave that to the clinicians. I'm not a clinician. I can't advise on treatment really, but I mean, they have been around quite a while and it is a recent issue that we're seeing with this. All I can say is that patients really deserve access to every kind of treatment that would help them manage their pain best. But what the report does also show is that there are very little other supports apart from these interventions. So things like self-management and really educating both the clinicians but also the patients on better deal with pain, faster diagnosis, and then things like the International Classification of Diseases 11, the latest version that classifies pain as a disease in its own right. That's implementation and starting to gather the data is so important really in changing the picture for pain that's out there at the moment.
It also says in this report that medical practices are lagging behind actually understanding how the brain deals with pain. Is that the area perhaps that health services need to focus more on? Absolutely.
There's no doubt that it's a complex condition. It can be secondary to something else, for example, like a neurological condition or perhaps arthritis or something else is going on. But when you're dealing with the body that is screaming at you in pain and there are no clinical signs that there's a cause for this pain, so you could be scanned or, there hasn't been a particular injury. And for a lot of patients, even when we survey patients each year, a lot of them feel it came on gradually. They don't have a traumatic event where it started. So it's difficult to pinpoint. So really the understanding all the way from the labs all the way through to bedside, really we need a curious mind looking at this.
Deirdre Ryan, it is a really important subject to highlight. Thank you for joining us on BBC News to talk